Granite Falls Living at Home Block Nurse Program, a member of the Minnesota Living at Home Network, provides direct services and programs for seniors and people living with disability in the southwest Minnesota community of Granite Falls. Granite Falls has been a dementia-friendly community for 5 years. In 2016, Granite Falls Living at Home Block Nurse Program began the process of making Granite Falls a dementia-friendly community with a public forum and by enlisting the mayor to issue a proclamation declaring June 21st Dementia Awareness Day in Granite Falls. Utilizing the Act on Alzheimer's toolkit, committees were formed, the community was surveyed, and areas of need were identified. Following several community forums, 4 areas of focus were identified for action: respite care for caregivers, a monthly memory cafe, a memory choir, and Dementia Friends training events. Several action team members became dementia champions. Training events were held in Granite Falls and neighboring communities for home health nurses and personal care attendants, long-term care CNAs, through chamber-sponsored events including bank employees, for living-at-home volunteers, and members of caregiver support groups. With support from a Department of Human Services LiveWell grant, respite care training for care providers was offered to respite care volunteers. Granite Falls Living at Home then partnered with Lutheran Social Services in offering respite care to caregivers in Granite Falls and surrounding communities. The Upper Sioux tribal community is located near the city of Granite Falls. Granite Falls Living at Home partners with the Human Social Services staff from within the Upper Sioux community to provide culturally sensitive conversations about dementia, led by tribal members for tribal elders. Granite Falls Living at Home partners with the Montevideo Memory Loss Network, MAMLIN, in offering the virtual dementia tour to the general public. The virtual dementia tour simulates what it is like to be living with Alzheimer's. Taking the tour helps caregivers and others understand what it is like to live with this disease. In the summer of 2016, a committee was formed to develop a memory cafe. With support from the Granite Falls Senior Advocate and using the Memory Cafe Toolkit, the Heart-to-Heart Cafe was established. Monthly meetings are held at the Granite Falls Senior Center on the 4th Tuesday of every month. The committee researched what it takes to make a warm, welcoming cafe, including a field trip to Wilmer, Minnesota, and a visit to the Forget-Me-Not Memory Cafe. One tip is to be sure the space is safe, warm, and friendly. Participants are asked to sign in and receive follow-up calls reminding them of the next cafe. The committee meets 1 week prior to the cafe to review plans for any special guests and discuss the theme of that month. Special guests have included musicians, visual artists, and local medical professionals. Following healthy snacks and refreshments, the cafe hostess leads in a discussion of that month's theme. The cafe usually ends with a group sing-along of familiar songs. The importance of volunteers cannot be overstated. The planning committee, working with Granite Falls Living at Home, arranged volunteers to participate along with clients and caregivers, providing assisted transportation to those in need. The popularity of the Memory Cafe sing-alongs made it easy to recruit members to the Building Bridges Memory Choir. Music educator Jan Larrell, leading an action team committee, followed the Giving Voice Toolkit in developing a rehearsal schedule and folders with music that she arranged especially for this new choir. The choir rehearses weekly in a community space provided by a local church. Following morning coffee and healthy snacks, the practice begins with vocal and stretching exercises. Halfway through the hour-long rehearsal, another stretching break is held with a music riddle, which always brings along with it laughter. There are so many amazing things to be said about the power of a memory choir. Music therapy has proven to be able to change the mental attitude of every member. It helps people who are nonverbal become vocal while singing. When everyone is singing, you can't tell who has dementia and who is the volunteer. In addition to providing a meaningful social experience for the choir members, the Building Bridges Choir performs regular concerts for the public and has gone on the road, helping to reduce the stigma associated with dementia at long-term care facilities, assisted living complexes, area churches, and this summer, a citywide celebration. As is the case with the Heart to Heart Cafe, it is volunteers that make the Building Bridges the success that it is. From preparing the morning snacks, the friendly telephone calls reminding people of practice, the assisted transportation, and sitting in as part of the group, all participants are simply members of the choir. In 2019, Granite Falls Living at Home began working with Compass teaching artists. Lauren Carlson, working with teams of two, a storyteller and a note-taker, introduced poetry as a means for sharing life stories. During the COVID shutdown, author Morgan Willow used snail mail to help elders publish their stories into chapbooks. Also during the COVID shutdown, while looking for ways to connect living at home clients and volunteers, staff discovered the Remember Project. Their powerful model of using drama and discussion has proven to be a game changer, bringing hope and support to the changes caregivers and their loved ones living with Alzheimer's are experiencing. Looking ahead, Granite Falls Living at Home is pleased to announce that it will be partnering with the Remember Project for one of their virtual plays. This will be a hybrid virtual model involving small group screenings with in-person facilitators in addition to individuals logging on Zoom at home. Plans are also underway to build on this in 2022. The services and programs offered through Granite Falls Living at Home are designed to offer seniors and people living with disability the support they need to live well, safely, and fully for as long as they are able, connecting them with professional care providers when necessary. Feel free to contact us for more information on our program or the Living at Home Network.